많은 분들께서 자리로 돌아오신 것으로 확인이 되어서 세션 2를 이어서 진행하도록 하겠습니다. 세션 2를 진행하기에 앞서서 몇 가지 안내 말씀드리겠습니다. 첫 번째는 만족도 조사에 관련된 것인데요. 오늘 현장
Before we start, I would like to give an announcement about our plans to do the survey with the participants here. This is for the sake of improving ourselves upon this year. So I'd like to ask your kindness to participate in the surveys. Please get into the application on your mobile phones and please refer to that for your survey. 150 people will be selected for providing you our souvenirs and gifts. So I wish you good participation of the surveys. Your valuable comments and information would be used for our future development of the next year's programs.
from you so that we can make next year's symposium even better. If you are on site, please scan the QR code to access the satisfaction survey page. And the first 150 people to complete the survey will receive a free gift. We'd like to hear your feedback about this symposium. 네, 다음으로는 오늘 저녁 환영만찬에 참가하시는 연사분들께 드리는 안내 말씀입니다. 오늘 저녁 환영만찬에 참석하시는 귀빈 여러분들께서는 본 세션이 종료되는 4시 50분 저희 스텝의 안내에 따라 랜딩관 1층 입구로 함께 이동하셔 주시면 감사하겠습니다. 랜딩관 1층 입구에서 오후 4시 55분 만찬장으로 가는 셔틀버스가 출발할 예정입니다. 여러분들께서는 4시 50분 세션이 끝나는 대로 저희 스텝의 안내에 따라 랜딩관 1층으로 이동해 주시면 감사하겠습니다. For those of you who will attend the welcome dinner banquet tonight, please follow our staff member to the landing result entrance on the first floor and take the shuttle bus heading to the dinner banquet venue at 4:50. 네, 세션 2도 마찬가지로 4분의 발표가 이어질 예정입니다. 준비된 시간 내에 세션이 잘 마무리될 수 있도록 발표자분들께서는 20분 내로 발표 시간을 맞춰주시면 감사하겠습니다. Will be proceeding as the same as session 1. And we'll be hearing from our 4 speakers. We'd like to kindly ask presenters to keep the presentation time to about 20 minutes so that we could wrap up the session in the time allotted. 네, 그럼 세션 2의 첫 번째 발표자를 소개하도록 하겠습니다. Ladies and gentlemen, it is my pleasure to introduce you to the first speaker of session 2. 네, 첫 번째 발표는요. 보건의료 ODA의 이해와 한의학 ODA의 추진 방향이라는 제목으로 연세대학교의 개원교수이신 남복현 교수님께서 자리해 주실 예정입니다. 여러분 큰 박수 부탁드립니다. Ladies and gentlemen, it is an honor to introduce the first speaker, Dr. Bokhyun Nam, visiting scholar of Yonsei University.
I'm Professor Nam Bok-hyun from Yonsei University. I'm pleased to present today on the current status of healthcare ODA and directions for promoting Korean medicine. As the world faces increasing challenges in healthcare, integrative approaches like Korean medicine are gaining attention. Today, we'll explore the current status of Korean healthcare ODA and how we can expand the global influence of Korean medicine.
네, 클리커에 문제가 있는 것 같아서 네.
There seems to be a problem with the clicker. Anybody who can help him?
Your kind understanding that there is a technical glitch with the clicker, so we're now solving up the problem. Please wait a second. 네, 현재 클리커 조작에 약간의 기술적 오류가 있는 관계로 수정 중에 있습니다. 잠시 기다려 주시면 발표를 재개하도록 하겠습니다. 네, 교수님 한번 확인해 보시겠어요? 움직일까요? 아, 네, 잘 됩니다. 네, 발표 부탁드립니다.
Now it works. Ladies and gentlemen, once again, please give him a big hand.
Today presentation will first look at the current status of Korean healthcare ODA. Next, we will focus on the current status and key challenges of Korean medicine ODA. Finally, I will present ideas on future direction on Korean medicine ODA and how we can explore its influence. ODA, or Official Development Assistance, is essential for providing resources to developing countries, improving their healthcare systems, and enhancing global health equity. The success of ODA is determined by several factors. At the individual level, the education and competence of healthcare professionals are critical. At the project level, successful identification, planning, implementation, evaluation, and performance-based management are necessary. At the organizational level, adequate budget, support, communication, organizational culture, and leadership are key. At the institutional level, legal frameworks, implementing bodies, and management systems are vital. Among these variable factors, today I will propose strategies for promoting Korean medicine ODA through institutional level approaches. First of all, let me introduce the historical context and key aspect of Korean healthcare ODA. Korea's journey with ODA began in the 1950s with aid from international partners. A prime example is the establishment of a National Medical Center, which was founded with support from Sweden, Denmark, and Norway. It was newly built in 1958, operated jointly for 10 years, and transferred to the South Korean government in 1968. At that time, it has the best facility in Asia and was the largest hospital in the country. Additionally, from 1955 to 1961, the Minnesota project at Seoul National University was groundbreaking international collaboration that allowed Korean healthcare professionals to acquire advanced knowledge overseas. This collaboration significantly improved Korea's medical education and research, and it has contributed to enhancing the global standing of Korean healthcare systems today. In 2009, Korea officially gained the status of a donor country by joining the OECD DAR. This transition was accompanied by the enactment of a Framework Act on International Development Cooperation, which provides the legal basis of ODA programs. Key institutions such as KOICA, EDCF, COFI, and have played a crucial role in expanding Korean influence in healthcare ODA. The establishment of these legal frameworks and specialized institutions ensures that Korea ODA effort strategy well organized and impactful. Let's take a look at the key organizations responsible for Korean ODA. First, in the public sector, we have the Committee for International Development Cooperation, chaired by the Prime Minister, along with the Working Committee. Key institutions responsible for concessional and non-concessional aid include EDCF, KOICA, and COFI. However, ODA is not achieved solely through government effort. Civil society, NGOs, private companies, and academic institutions all participate. NGOs and academic institutions implement community-based healthcare initiatives and provide technical expertise. This collaboration approach ensures that our ODA programs meet the specific needs of recipient countries. From 2020 to 2024, Korea's healthcare ODA budget has increased significantly. By 2024, it is expected to reach approximately 6.3 trillion Korean won, currently equivalent to 4.677 billion US dollars, with a substantial portion allocated to healthcare initiatives. Investments are focused on strengthening regional healthcare system, building emergency medical services, and providing health policy consulting. These strategic investments reflect Korea's commitment to improving global health. Let's analyze the key healthcare support area managed by COFI, a specialized healthcare ODA agency. 29% of the budget is allocated to strengthening regional healthcare systems, including maternal and child health, primary healthcare, and emergency medical services. Another critical area is capacity building through the Lee Jong-un Fellowship Program, which trains healthcare professionals to manage public health systems. Following this, hospital operation consulting and medical device management programs have been identified as priority area. Let's take a look at some of the best practices in healthcare ODA carried by COFI. These include the strengthening of primary healthcare system, project focused on enhancing regional healthcare system centered around emergency medical care, and consulting services for the operation and management of healthcare facilities. Next, we have the medical device management system enhancement project, the Lee Jong-un Fellowship Program, and the infectious disease management capacity building project. These initiatives aim to improve healthcare infrastructure, train healthcare professionals, and strengthen the ability to manage infectious disease. In addition, there are projects focused on strengthening non-communicable disease (NCD) management, health insurance policy consulting, and public-private partnership initiatives. These projects aim to enhance disease prevention, provide expert guidance on health policy, and foster collaboration between the public and private sector for more effective healthcare delivery. Now, let's take a look at the legal framework that governs ODA. Legal systems seems generally divided into civil law systems on the left and common law systems on right. At the top of the legal hierarchy is the constitution, followed by laws, presidential decrees, ministerial audience. Korea followed the civil law system, which includes administrative rules, such as notifications, guidelines, directives, and instructions. Today, I will provide a detailed explanation of directives within this system. The first step in the ODA implementation system is understanding its legal foundation. At the top is the Framework Act on International Development Cooperation, enacted in 2010. Following that is the third Comprehensive Plan for International Development Cooperation, covering 2021 to 2025, which is updated every 5 years. There is also an annual Comprehensive Implementation Plan for International Development Cooperation plan. Lastly, we have the 2024 directive issued by the Ministry of Health and Welfare. The second step is ensuring policy alignment. These laws we believe so far require that all ODA projects align with global standards, such as the Sustainable Development Goals, SDGs, as well as Korea's Indo-Pacific strategy. At the same time, there is a flexibility to adapt projects to meet the specific needs of each country. This balance ensures that ODA efforts are both globally relevant and locally tailored. The third step is the project review and selection process. It begins when the recipient countries submit a project concept paper, PCP, to COFI. The project is then reviewed by the Ministry of Health and Welfare and the Ministry of Foreign Affairs. After this, it undergoes budget review by the relevant ministry and the National Assembly. Finally, the International Development Cooperation Committee makes the final decision to approve the project. Let me now introduce the Korean medicine ODA ecosystem. Korean medicine faces unique challenges with the ODA ecosystem. One major issue is the lack of scientific evidence for some practices, which can lead to skepticism. In response, we are investing in rigorous research to prove the effectiveness of traditional treatment. Another challenge is integrating Korean medicine into the existing healthcare systems of recipient countries, which requires collaboration and regulatory frameworks to address safety and efficacy. Key areas for improvement including evidence-based scientific research, establishing internationally standardized regulation and safety measures, enhancing collaboration among professionals, shifting public perception, and creating policies that are favorable to Korean medicine. Let me introduce the National Institute for Korean Medicine Development, NICOM, established under the Korean Medicine Promotion Act in 2004. NICOM is at the forefront of research, development, and capacity building efforts. NICOM play a crucial role in promoting Korean medicine. One of its key initiatives is to develop standardize practices, and collaborate with international health organizations to ensure the global recognition of Korean medicine. Let's now discuss the SWOT analysis of Nikon. Strengths includes strong government support, established R&D infrastructure, expertise in traditional medicine, and wide institutional network. Weaknesses are limited global market penetration or lack of extensive clinical evidence, cultural and regulatory differences, and language barriers. Opportunities include the growing demands for alternative medicine, expanding international collaboration, potential expansion into emerging markets, and development of new products and services. Threats involves competition with other traditional medicines, changes in government policy, intellectual property issues, economic downturns, and local regulatory challenges. As we move toward the conclusion, let's discuss the future directions of Korean medicine ODA. As I mentioned at the beginning, I have summarized 5 key recommendations for the future of Korean medicine ODA. First and most importantly, DCOM's budget needs to be expanded. Second, we must improve adaptability to changing environment. The Ministry of Health and Welfare has issued directives this year. So, I encourage active participation in the consultative bodies and effective use of COFI's overseas offices. Third, we must focus on developing specialized professionals, utilize external experts. Fourth, it is crucial to establish a clear strategy for Korean medicine ODA. Lastly, I recommend strengthening leadership and governance structures. Thank you for your listening.
네, 보건의료 ODA에 대한 설명과 한의학 ODA
Thank you very much for the wonderful presentation about the future trend of Korean medicine ODA ecosystem. Thank you very much, Professor Nam. Moving on, I'd like to invite Mr. Kim Jae-kyun from Asia Development Bank.
인간사회개발실의 김재균 보건 전문관님께서 발표해 주시겠습니다. Ladies and gentlemen, our next speaker is Dr. Jae-gyun Kim, Health Specialist at Human and Social Development Office of Asian Development Bank. He'll be presenting on the topic of harnessing traditional and complementary medicine for achieving health and well-being, the strategic role of ADB in Korea in providing technical support in the Asia-Pacific region countries. 네, 여러분 다시 한번 큰 박수 부탁드리겠습니다.
네, 소개 감사드립니다. 지금 아시아개발은행
So thank you very much for kind introduction.
Kyun Kim. I'm a health specialist working at the Asian Development Bank. Looking at the audience, I see majority are Korean, so please allow me to present my presentation in Korean. I'll be giving a brief overview of ADB and how ADB functions in the health area, and then go to our main discussion on the strategic role of Korea and ADB in this traditional medicine global health. So ADB, I'm not sure how much people here. 죄송합니다.
I actually said that I'm going to make presentation in Korean, but I continued with English, so I'm sorry for that. I don't know how familiar you are with the ADB. ADB is a regional multilateral development financial institution, and it stands for Asia Development Bank. And I think that among the multilateral development banks, the most well-known is the World Bank, and ADB is the Asian version of World Bank. It was established back in 1966, and Korea participated as a founding member of the ADB. And here you can see, and also Korea has made a significant contribution to ADB for various ODA projects for developing countries. Now here, if you look at the ADB's regional footprint, you can see that ADB actually covers a very broad area of the Asia. So it includes all the island nations, and its headquarters is located in Manila, Philippines. So I am also from the Manila, and it also covers the East-West Asia as well as the Caucasus, three countries. So the Georgia, Azerbaijan, and Armenia, they're all part of the ADB. So total. Here you can see the total 67 countries are the members of the ADB, and we have about 3,000 employees globally and 45 field offices across Asia. So here you can see that we actually has a very broad regional coverage. Now let me talk about the health sector for ADB activities. So we do have a Health Sector Directional Guide 2030, which is a guiding document for our activities, and our goal is to achieve UHC in Asia and the Pacific, and also the PHC. Here you can see some key trends and challenges at the global level. So I think one of the most notable change that we face today is the demographic aging, and also the subsequent disease incidence rates. So in the past, we had a high incidence rates for the infectious disease and acute disease, but NCD has become more and more prevalent issue. And the second trend is the climate change. It affects not only the global healthcare sectors. I believe this is one of the hottest topic in the global agenda in various aspects. And I believe there has been a lack of search to find out some linkages between the climate change and traditional medicine. So if you do have any good idea, please let me know. And next is the decentralization and regional cooperation. In fact, this phenomenon reached its peak during the COVID period. So we actually saw how important it is to have the regional cooperation for the vaccine supply and also the therapeutic development. And we also saw that how problematic it could be if a country monopolizes the system. And Asia, we also saw some barriers. And the next trend is the pandemic threat. So most people, I think that they now forget about the COVID-19 and what we experienced, but the wave of the next pandemic will surely come. And recently, we experienced some infectious diseases, and digitalization is also another big trend that we are facing today. And regarding digitalization, I think that this presents both an opportunity and threat. So for some countries, it can be a threat, but some countries, I think this could be opportunity, especially if you are well prepared. So digitalization is not an option, rather it's a must, and it will come surely. So we really have to be fully prepared for this. And for ADB, rather than focusing on disease and therapeutics, we focus on improving the overall healthcare system. So we have to have a governance policies and public goods, and also the health financing and incentives, including private healthcare insurance and so on. So we are involved in these kind of projects. And also health infrastructure system and health workforce. These are another important areas that we focus on. Health financing, incentive, pandemic preparedness, and so on. So this is the health sector directional guide that ADC produced, but ADC is a very agile organization. It's also very flexible. And therefore, if there is any request from a country, then we immediately respond. And one of the area that we receive a lot of requests nowadays is the traditional medicine. Now let's take a look at the pandemic. So during the COVID-19, ADB has conducted a very important role in Asia for the vaccine procurement. For example, just like the COVAX, we had the vaccine supply facility called the APAX, and Also, we have done a lot of works to be prepared for future pandemics. And our ultimate goal is to achieve the UHC. We have made significant progress, but still we have a long way to go to achieve the SDG goal number 3. In particular, the catastrophic health spending. This is something that we really have to make improvements. So including Korea, there are many countries that have to make improvement in this field. And also next is about the aging. I think this is going to be a very serious problem, especially in Asia. And next is about the NCD. As for non-communicable diseases or chronic disease, I think that there are some biases that the NCD is important only in rich countries or high-income people. But if you look at the statistics, NCD is a threat that the whole world is facing. So including the Mediterranean, the Middle East, Asia, and so on. And if you look at the income brackets, not just the high income, middle income, low income, everyone in different walks of life, they're all affected by NCD. So this is something that we have to focus on. And for the NCD management and also the aging, I think that traditional medicines do have a lot of roles to play. Next is about climate change. And as for climate change, in two aspects, we have to approach this matter. One is the climate change mitigation, and the other is adaptation. And as for the mitigation, this is to reduce the carbon footprint and carbon emission. And I'm not quite sure how we can link it with the traditional medicine, but I think a lot more linkages can be found with the adaptation. So adaptation is to reduce the risk of the climate change by bolstering the healthcare system. For example, like by preparing a better system to prevent the malaria or the dengue fever. So with the global warming, the malaria incidence rate is increasing, and also countries that have not experienced this kind of diseases before are now seeing these diseases coming to them and affecting them. So this could be related with the adaptation. And digital health is another area that we focus on. Korea is in fact the leader in this field, and Korea has made a lot of cooperation projects with ADB regarding digital health. Now here you can see the ADB's health portfolio. So before pandemic, it represented only 2 to 4%, but then during the pandemic, it increased to 30%, and we tried to maintain it around 6 to 8% level. So as of the year 2024, what we expect is the 2.1 billion US dollar will be injected for the health commitment, so which is about 1.7 trillion Korean won. And the World Bank is the largest contributor for the health sectors. Their annual budget for health sector is the $4.4 billion. So ADB represents the half of the World Bank's contribution. But the World Bank, they actually cover Africa and also the North and South America as well. And a lot of money is spent on these areas. So if you just look at the Asian area, ADB is the biggest financial contributor. And also here you can see these are the proportions of the health commitments that ADB has made by geographies. And you can see that there is nothing for traditional medicine. There are some small projects of collaborations, especially with regards to aging and chronic disease management. But aside from that, I think we really have to make some improvements in this field. So we look forward to finding partners in this field. And also the ADB, we do have loan, grant, technical assistance, and private sector investment. So we strongly encourage the engagement with the private sectors, and we strongly seek partnership with the private sectors. Now let's move on to the strategic role of the Korea and ADB on TNCM support in Asia Pacific, which is the main part of my presentation. But before talking about that, I would like to ask you a question. that do you think that the traditional medicine it remains high on agenda for the healthcare, global healthcare system? I think very few people will say yes. Even for those are involved in the global healthcare, they don't think that the traditional medicine is important. And for those are involved in the traditional medicine, they are not really interested in ODA project. So at least for these audiences, I hope that I can succeed in persuading and conveying my message. And this is the 2018 data, which is a bit outdated, but this is very, very impressive and insightful data. So this is a maternal death rate in the Aklan province of the Philippines. And so it was a part of the maternity health project. And I participated in this project as a KOICA employee. So it was not the ADB project. And you can see that 11 people died in 2018. And we looked into why these people died. And KOICA, we had the KOICA healthcare experts and also WHO experts and also people from the provincial government. So those healthcare experts all gathered together and we had heated debate on what killed these pregnant women. So there was a lack of access to healthcare facility and also the lack of UHC coverage. So these were the things that were cited at the time as reasons. But here you can see you can see an attendant at delivery and the hilot, it's a traditional midwife in the Philippines. And out of the 11 people who died, 5 of them you can see where the delivery was through the traditional midwife. But nobody has actually talked about that. So that midwife is called hilot. So this indicates that traditional medicine can actually cause some problems, even for this kind of maternal health care. And if you look at the recent statistics, especially the low-income provinces, in fact, the delivery by hilot represents 10% of the total birth. And I don't think that this issue is limited only to the Philippines. This is the data from the WHO as of 2018. So they looked into the countries all around the world and they tried to identify which countries use the TNCM. So green indicates countries that use TNCM and white indicates the countries that didn't provide data or reply. And you can see that there is very, very few pink country which do not use TNCM, which means that the most of the countries across the world do rely on TNCM. And therefore, do we have to regard TNCM as a global health issue? Regarding this question, I think that depending on the country's income levels, the different frontline healthcare workers are involved. So, for example, like mid-income countries like Korea, we do have the medical doctors in all hospitals and also the community clinic centers. But if you go to the lower middle income country like Philippines, you can see that the midwives are present in the barangay health station, which is the community health station. And they also have the barangay health workers or community health workers, and they serve as frontline healthcare workers. For low-income countries like Ethiopia, traditional medicine practitioners, they serve as frontline healthcare workers. And many countries are actually in this category. Primary healthcare is a core to achieving UHC. In the ideal world, PHC will be covering all the population and communities in the country. But in reality, very few countries are capable of doing so. Maybe only some OECD members. So for these, I think for many countries, the TNCM can play a huge role to play to promote PHC, but somehow they have been neglected and overlooked. I'm not going to comment whether it is good or bad for the widespread use of TNCM in low and middle income countries, but the reason that TNCM is widely utilized in low and middle income country is because of the resource poor situation. But rather than talking about whether it's good or bad, uh, we have to understand that this is the reality that these countries are facing. And if you look at the Lao People Democratic Republic, you can see that they do have very heavy reliance on TNCM. And if you go to Tonga, I don't know, situation may be different today, but a few years ago, 99% of the patients with the mental disease, they receive treatment from the traditional medicine doctors because throughout Tonga, for the whole country, there is only one Western medical doctor for mental health, only one psychiatrist. So here you can see that TNCM is spreads very widely for tuberculosis, but or the malaria. We don't really have the global fund for TNCM. There is no funding organization for TNCM for maternal health. WHO is involved in promoting TNCM, but again, to a very little extent. And also there is a lack of research and funding, so situation is not going to get better. So your roles are very important, and so I think that there are very few countries who can contribute to solving this problem. So Korea or India or China with strong TNCM, I think they can play an important role, especially Korea, because we are an OECD member with a strong root in the TNCM. I think Korea does have a very unique role to contribute in this issue. And WHO has come up with a traditional medicine strategy, and it's going to be extended until 2025. So recently, they are working on a new version of this strategy. And there are two goals under this strategy. So the first one is to harness the potential contribution of TNCM to health and wellness and people-centered healthcare and UHC. And the second goal is to promote safe and effective use of TNCM. I think the second goal is much more important than the first goal. So here you can see the section for critical indicators. So they look at the number of member states who do have the national policies for TNCM and how much budget is allocated to TNCM for research. So if you look at these strategy, I believe that you can get some idea on what areas Korea can be involved. And the second one is about the regulation. So this is to strengthen quality assurance, safety, and proper use and effectiveness of TCM. Regulation is the key, and regulation can be made in three fields. The first one is the traditional medicine product, and second is for the TCM practitioners, and third is about the services. And as for the product, I believe that KFDA does have an excellent legacy, and we have a very strong and rigorous regulations. And they have also participated in various ODA projects, and I hope that their contribution will be expanded further. And for the practitioners, we have a competency building programs and also the training, as well as the existing education program. And this is something that can be helped by the universities. So I hope that the universities will expand their roles here. And the third regulation sector is the service. Next is about research. Rather, this is about the medical service delivery. So this is like how we can cover the TNCM with the healthcare insurance and provide reimbursement. Now, this is my final slide. I said that the TNCM is not included in the ADB health portfolio yet. I really want to include that, and for this, I need your support. So this is just my personal vision, but this is an example that of the project that I could suggest. So the project is about harnessing TNCM for achieving health and well-being in the Asia Pacific region, and funding will be made in the format of grant, and we can utilize the EAKF or East Asian Knowledge Partnership Fund, which is provided by the Korean Ministry. So if you partner with the Korean companies, you're highly likely to achieve this grant from the Korean government. So maybe we can start small. So ADB can contribute 1 billion or the 0.5 million or 0.55 billion. And the coffee can also provide some co-financing. And with this co-financing model, we can conduct the ODA projects, maybe countries like Philippines, Cambodia, Mongolia, Laos, Vietnam, Nepal, Turkmenistan, Bhutan. These are very good candidates. Uzbekistan is also a great candidate for this project. And here you can see some target areas. So there is a separate regional framework for the West Pacific office of WHO, and I just brought that. And maybe tomorrow the Wipro personnel will talk about this more in details. But I think NICOM can be involved for regulation and MFDS as well. And also for service delivery, I think that the HIRA or the National Health Insurance Agency can be involved. And for research, I think KIOM or the academia like the Busan University and Kyung University, they can be strong partners. And one thing that I included, the things that is not in the regional framework, is the public-private partnership. So a lot of countries are highly interested in PPP. When I have a meeting with other countries, they are highly interested in the Korean traditional medicine substances, and they want to utilize that for new drug development or for commercialization. And Korea does have a very strong private sector, so this is something that Korea can contribute a lot. So I hope that the Ministry of Health and Welfare, COFFEE, NICOM, the KIOM, MFDS, and academia, we can all join hands together. And there is surely a strong need. Recently, the Minister of the Health and Welfare of the Philippines, I had an opportunity to dine with him, and we talked about the dengue fever and malaria. But then all of a sudden, he asked for the support for the BTAC. So BTAC is a kind of the NICOM of Korea, the Philippine version of the NICOM. And all of a sudden he asked for the support for BTAC. So this indicates that the ministry is also interested in the traditional medicine because we have not had the kind of platform, so the needs have not been brought up yet. But I believe there is surely a need, and there should be a magic triangle for successful business. So the first one is the needs of the countries, recipient countries, and second is the technology that can implement and address their needs. And third is the finance. So there must be some needs by the recipient countries. And second, technology and budget, which should be covered by Korea or can be covered by Korea. So with this triangle, I believe that we can have a successful partnership and successful project. And with this, thank you very much.
네,
Thank you very much. In order to achieve the goal of AUS HDG, the organization has been working so hard. ADB as well has been in collaboration with our Korean counterpart, and I also hope that the future can be bright for you. Next, I would like to invite Professor Che Han of Busan National University for his speech of the development of strategy for traditional Korean medicine ODA.
Under the title Development Strategy for Traditional Korean Medicine ODA. 여러분 큰 박수로 교수님 맞이하겠습니다.
Please give him a big hand. Good afternoon. My name is Che Han. I've been hearing a lot of good things prior to me. I'm going to speak my own mother tongue. The reason is because that I wanted to give more detailed presentation to people in Korea rather than those from other countries, because my advice can be given to those people who are working inside Korea for the strategy development. Having said that, Korean language would be preferred, and also in the process of using my own language, I believe that the content is quite shortened. I am going to give you some kind of exaggeration or emphasis so that you can get attention on this. I'm going to also talk about a lot of my experiences, and I have been studying and also looking at what kind of things can be improved in terms of the ODA in Korean medicine. So let me briefly talk about my own experiences and my lessons learned in my practices. As for me, starting from 2022, policy was my agenda, and also I was in charge of the practices in the Middle East and East Asia. I have been asked to answer these questions about these questions in the Asian Development Bank and for the countries and technologies the budget can be supported. And having said that, many organizations can be collaborating together. That's the thing I learned from the previous speaker. But actually, ironically, that's the reason why we couldn't do that. Two of the speakers are laughing at right now. The reason is that we need somebody who can bind these two together, not separating them. And there should be also the organization at the government level to tie them together. Do you know why I just have my beard growing? I've been to these Central Asian countries many times, so am kind of mingled with them. So I am now thinking from the perspective of Central Asian countries. What I emphasize here is that everything should be focused on the recipient countries, not the donor countries. That is a tough nut to crack, but if you really want to be in the practice of ODA, you see there are so many people coming in right now. There are policymakers and there are policy evaluators. There are so many kinds of professionals and experts. However, if you go into the practices, if you are really want to take the national agenda, there's nobody who can do that because the job is really tough. What I'm thinking right now here is that since I am a professor at a national university, my job is to teach my students and do the research. Of course, I am a government official because I'm working for national government, but I sometimes think myself as someone working for the Ministry of Foreign Affairs because I am responsible for bonding all these organizations together, and I am given the job of finding solutions out of all these challenges, and they're really, really mandating jobs. We have a lot of researches and ideas for the Korean medicine. We have many people working at the Ministry of Health and Welfare. There are so many experts, but nobody can be really helpful for them. I wouldn't say nobody, but as I said earlier, I'm going to do the overemphasis in my rhetoric. So that's why I'm saying this. I am really pressured to give my results. As I said, I'm working for Busan National University. if there's no team of people working together, nothing will be solved. I need the support from many organizations. That's why I'm saying that, and have to call somebody. So in order to make a call, who should I talk to sometimes? So my answer, the answer receive is that I have to meet with the ambassador from Turkmenistan. I have to meet with the financial guys at the university. I have to meet with the government officials at the Ministry of Health and Welfare. So the list goes on. I have to meet with them all the time. So if I meet with them, I have to spend the whole day. So my job, even though I'm working overseas, is not splendid or colorful, and I don't make money from day one. However, if I tell you about these people in the industry, for example, in the Korean medicine field, if they really want to go overseas, you have to come to me somehow because you cannot avoid me when you want to go overseas in terms of this expansion overseas. If you don't meet me, you cannot get the budget, as I say. The reason is that we are not looking at just tomorrow or the day after when we make investment in other countries. We're looking at 30 years later or 40 years later about Korea. That's why we have this organization. And also for your reference, I'd like to take this opportunity to express my gratitude to all the colleagues here in my university. As for the urban medicine, we have Professor Shinhwa, who has been working so hard and working with me, and Professor Yang Gi-hyun, who may be in this building or around. He has been also working with me as by forming a team of researchers together. There's a saying that the three professors of a national university can make a miracle if they really want to do something. What it means is that it's very difficult to combine three professors at a national university together for any project. Therefore, if you want to do something about this, there should be a logic behind it. If there's a logic to explain, we can explain the future and long-term plans. And also after that, you have to know how you can apply them in the actual day-to-day businesses. That's also very important. So prior to me, we had two speakers, right? So after hearing them, you have to know about the daily practices that I'm going to talk about. In 2022, I was working as a policymaker in the Korean medicine. The Association of Korean Medicine gave us the funding. And there were several reasons for me to spearhead to do this. I have a very diverse background personally. For example, I was working as a Korean medicine doctor at the military for 3 years. I used to work for the private universities before the Busan National University. I was in the industry, and also I am a maker of a diagnostics device, and I'm a seller of that. I have been working in the clinical research, and I also do the treatment, and I'm also a translator of a book and the researches. What I'm saying here is that I really have a man of diverse experiences, and I have the ability to put everything together, and that kind of capability is really important. This is abstract. What it says here is that there are keywords about what ODA means. First of all, ODA refers to various forms of support. By various, it means that there should be adaptability to a condition of a country, where sometimes you can think of the clinical things when you go into one country. So it says that the various forms of support. Here, support is really important. It's only about support down the road. It's not about making by ourselves. It also says that provided by public institutions of donor countries. Also, it means here is that we're not selling Korean medicine industry to a recipient country. We are helping them to make their own traditional medicine industry. So you might wonder, why do we have to help other countries to grow competitors of our Korean medicine? So the answer to that is that Korean companies should be playing a role in this. So this is co-prosperity and co-development. It also says that, let me continue, to promote economic and social development and welfare improvement. So we do both the economy and the society. So we have to put our shoes together in these two different perspectives. And also we have to compare that with Korean society. That's why we are emphasizing both the economy and welfare. So a, the subject here is the recipient country. It's not about Korea, it's about the countries that are receiving the ODA. Having said that, if we are to help other countries, it's not about only one country to help. It's about many countries, and down the road, it's about the global development. Of course, the world development can help Korea in the opposite way as well. That's why we have to have a very good definition of what ODA means. I'm going to now give you some examples of this definition of ODA. I have one failure case and one success case. So this is about what we have repeated in the past. Next, it's about the Korean traditional medicine. In this case, when we talk about ODA, what does really mean when we talk about the Korean medicine ODA? It means that we have to be treating with the economy, science, technology, and many others of Korea. Therefore, the Korea wave or the Hallyu can be also part of this Korean medicine ODA. Maybe I'm also overemphasizing or exaggerating this, but I have to tell you that in the Korean dramas, in the Korean drama series, the women's status has been increased and enhanced over time. So that will be positively impacting other countries in terms of their wave of making the emancipation and improvement of women's status. That's one example. Secondly, when we want to know about where ODA can apply, normally you would say that if it is about Korean medicine, you will be having the keywords like the yin and yang and also five elements. Yes, you're right, but it's more than that though. We can have the medical acupuncture as well. That is reflecting upon what we have had as of 2024. So if you have this kind of background of the modern times, you have a lot more to do with Korean medicine because it has acupunctures, it has many others. The next one is about the ODA. So on the right side, this is a Venn diagram that you can see. One is O, the second one is D, and the third one is A. It means that three of them, O, D, and A, should be all fulfilled. So when we have the official development assistance, you have to be official enough to have the public institutions or Korean government to be involved. So if it is private, maybe it's a little bit far from the ODA. Maybe private sectors or some of the current private companies can be involved, but they are not the leaders anyhow. So the leader should be the public organizations or the government. The second D stands for development. Development means economic and social advancement or progress. The third one, A, means assistance. Even though the budget comes from Korea, the ultimate development will be enjoyed by the recipient countries. So that's a concept we have to have. However, this was a very difficult idea that could be obtained in the past by Koreans. Now, let me talk about core values of ODAs. If you have the ODA, what are the real important values here? Number one is recipient rather than donor. ODA for the sake of donors will not mean anything. We have to work with the recipients. Therefore, we have to have the need analysis for the recipient. In my case, I am doing the work in Turkmenia, and there's only one reason for me to do that. If you recall, the Central Asia, Turkmenia is not a core country. Nevertheless, we're working for that country because we have the top leader of the country who was very much interested in ODA, and he was the trigger of this ODA, and he had mentioned it personally and directly. That's why I am there. The second core value of ODA is ownership, alignment, and participation. This might be confusing to some people. We have to make sure that all these ODA things should be in line with the lines of each recipient country. Therefore, we should change ourselves in order to get to these countries. How many countries are there in the world? I have a question. More than 200, right? How many countries are the members of OECD? About 40, top 40 countries. So it means that the remaining 160 countries are the targets of the ODA programs. Of course, we have global south countries, which are the least developed ones, and also we have the ODA programs from the least developed countries to the least developed countries. But in our case, the has the Korean style ODA. We're not pursuing the most sophisticated ODA, which is in the middle. What I'm saying here is normally is that if we have a lot of things that are really used and overused many times, those can be the subjects and targets for the ODA for other countries. I'm not saying that we are just doing the useless things for other countries. We are providing something useful for these recipient countries that cannot be overused in Korea. Now here, the effectiveness and performance-based management, it will be important. So I'm referring to SDGs here. SDGs are not actually something particular or these unique here. So SDG is also in use by Busan City, where I'm working at. So here, this performance based is really important. As I mentioned earlier, for the use of the Korean medicine, science based will be very important. This evidence based medicine will be very important. What I'm saying here is that I have to know whether this will be very useful or effective. So I ask you to think about the effects of this. So when we talk about the performance-based management, I recall when I started ODA, I remember talking to my people. So why don't we just think of this project as something that can be in the middle? We don't have to finish it. Doing this is important. What if we have a coup d'etat in one country where I'm working? Can we do anything further? No, because we have to get out of the country once the coup d'etat is started. So you have to make sure that everything should be recorded. Your breathing should be recorded. So this everything is in the process. If you really look at the end result, nothing will be started. That's what I'm saying. The last core value of ODA is sustainability. I'm also having a saying that, oh, what we are doing, this is in the middle, this is in the process, it's meaningful. Even though we are Korean medicine ODA, can we take Korean medicine out of the Korean medicine ODA? Can we do the ODA without Korean medicine doctors? The answer I receive is that no, we cannot do that. And I say, yes, that's right. But even if we do not have the Korean medicine doctors, we have to be able to do the Korean medical ODA because even though we do not have the core important elements, we have to be able to pursue at the things that we have done so far. It means that the Korean doctors can be out of this circle, but we only have to make the network maintained with them, and then they can provide a system as the fundamental basics. Next, I'd like to ask you to think about the SDGs that everybody seems to know. SDG, they said that this is quite Korean niche because SDGs have the final board that has been impacted by Korean voices, they say. I heard that there are so many things that Korea wanted to have on this SDGs. What I want to emphasize out of the 17 here is number 3. Of course, there are many more important goals here. So if you have this number 3 here, we can expand it more, like 3.1, 3.2, 3.4, things like that. Let's look at 3.4 here. So what can we do here in this? So not NCDs, are mentioned here. So the Korean medicine has been doing so well with this paralysis. in treatment here. So in the past, so this is something that we have used and overused many times, and that can be exported to other countries. Why don't we go to 3.4 A? That's about the non-smoking practices. So we can do the non-smoking acupuncture system. And also 3.8, we have the poisoning. So poisoning is a hot topic nowadays. If you are a researcher of poisonings, you can use your acupuncture system to control and treat the drug abuse and also the paralysis. So 3.7 here is the maternity treatment and care, maternity care. So we do have a lot of Korean medicine doctors who are working on this. And 3.8, it's A, we can use Korean medicine to treat these diseases. What about 3.9? This is about the environment. There are so many people who are emphasizing the importance of environment. It's for the overculturing. Because of the climate changes, there can be countries that can grow some of the herbs or not. So we have so many applications based on the Korean medicine, so we have to be able to cover all of them. But I told you earlier, if you remember, there will be no volunteer to do that. No one would be able to come up to me to say this. So 95% of them will not be able to do that. So Professor Song, who is actually hands-on here, is quite a rare gem, and I am an anomaly in this industry because what I'm doing right now and what I'm just in my practice, if I am a subject of a academic paper, so I have been writing about more than 10 academic papers last year, and I could have done more than 10, and also I could have more than 10 the year before. So it means that I have made a lot of sacrifices, and also it's like 117 million when for my work. It has not been so much helpful to me this time, even though I received it. So nothing's in it for me. 2 days ago, I was in the KDI. I made a presentation to give them what I would like to do as my initiatives. After listening to them, they didn't judge me. They just said that I give you my condolences for your future work. That's what I received as a comment. So do we have to give up ODA? You might ask. But if you have the 6 to 7 trillion won of the whole projects of ODA, how much do I take it? So depending on the calculation, it would be a different, but I'll almost get to near zero. So what is the most typical ODAs? Now, it's very ambiguous to say which are the best ODAs. Now, focusing on the success and failures of the ODAs, I'm going to give you some experiences. They have been both the overseas ones. Number one is 80s rice market destruction. So Haiti has the event in 1986 when the dictator was taken down. And then Haiti received 24.6 million US dollars as a loan for the IMF from the IMF after the incident. And then they were asked to reduce the tariffs on rice. And then there is the word Miami rice in the middle of the sentence here. It means that from the US, rice at the cheapest possible price went to Haiti. That destroyed the fundamentals of the rice industry. So it started as an aid and loan, but it was ending up as a destruction of the rice industry totally for the Haiti as a country. So the intention was good, result was bad. That's a failure case. The second failure case is the BRI, Belt and Road Initiative by China. Of course, here it can be seen differently depending on how you are looking at it, but there are so many negative side more than positive side. What I'm trying to tell you here is that we've been hearing from the ADB, right? So the loan provider was the organization, but loan is really a debt. Therefore, you have to pay for it. So loan giving seems to be a good thing, according to what I hear, but loan is not a grant. The grant doesn't have to be paid, but loan should be paid up. So it is the debt and also the diplomacy was linked with that. So China's BRI was negatively pointed out that they are just linking it with the diplomacy. Also, it's called debt trap diplomacy, and also it has the loan provider as Chinese government, and the recipient of the debt seems to be the local government of the recipient country, but also, all the expenditures and the human resources are provided by China. Therefore, nothing is left for that recipient country. That recipient country will not keep anything in a longer period of time. So that was the second failure case. Success cases, let me refer to them. So it happened to be both of them are Korean cases. Number one is Semaul Undong New Village Movement. When I heard about this case as a success in the beginning, I was wondering myself, what could really be useful about this? But this is another case of what I'm saying as using and overusing what I have done so far, because Sema Undong has been used so much by Korean people. So here, if you look at the definition here, it says a community-driven rural development program in the 1970s. When I was younger in the 1970s, I heard my grannies and grandparents saying that Korea used to be the really a beggar country and had nothing to feed on. I told you that there are more than 200 countries in the world, and also out of them we became one of the richest countries nowadays after going through that period of the starvation. So this is a amazing thing to do. And also we are looking at other peer countries, and all these peer countries are saying that we can copy what Korea has done so far, and we can be confident about doing this. That is the biggest thing that we learned so far. So Koreans are now getting the courage and role model for other countries to follow. That was the success case number one. The second success case is the Korea Program on International Agriculture COPIA. So Korea and agriculture has the word of COPIA. This is homologous of the utopia, so it seems like a very fancy fairy tale of Korea. So that's right, because Copia offered practical, comprehensive knowledge transferring, effective, and scalable solutions. We used to be a very poor country having difficulty of making the rice out of the paddies, but we have surplus of rice nowadays, and we do not have any mouth to feed nowadays. So I wonder if you have heard that the corn plantation has been used in Korea's rice production technologies nowadays. It is quite well known. So if I just give you these success cases like these, forgetting about the failure cases, there can be a lot of lessons learned for the Korean medicine industry as well. So except for the four things in the middle, if you only look at the strength and weakness and also the opportunities and the threats, first of all, starting with the strength, we have the 7 years of success stories. Nobody can beat us with this because U.S. should have money to do that. Maybe U.S. might have has the money, but they don't have experience of growing like this. And weakness is lack of ODA experts. I'm telling you that Korea has a lot of areas and fields out of them ODA has not been reaching Korean medicine. That's the only area when ODA did not reach. Therefore, we haven't thought what Korean medicine can do in terms of ODA for other countries. We haven't thought about it at all. But I'm telling you that we have a lot to do in ODA for the Korean medicine. Also, these opportunities that we have a lot of areas that we can work with the Korean medicine. Korea is really unique in the world because we have grown from the recipient country to a donor country. So that's a great story to tell. threats. There can be many. So at the bottom, I'd like to point this one, as mentioned by our professor. We have the competition amongst those countries of China and the US, and India is also working very hard onto this. So we have a lot of more competitors coming on in terms of the traditional medicine. So what can we do in order to beat our competitors once we do not have any ODAs? But we, as you think, we have a lot more that we already have. As I said, I am a man of experiences. I have done a lot of things like clinical trials, working in the companies, many others. So I have one or two papers at the SCI level. I can just present them to the SCI my journals. So I have a lot of things that I can offer you. So with that, I have made a strategy for you to consider. So this is the final development strategy for Korean traditional medicine ODA. Core vision, that's about the improvement of primary healthcare competence through traditional medicine. So I just came up with this idea because it is very overarching development. And the strategy and goals, number one, develop the indigenous traditional medicine competence of recipient countries. So competence improving is really a big thing to do. If you have the developing countries, you might have heard that training recipient countries, if they are developing countries, if you have the trainers like me, we are welcomed, while the medical doctors as trainers are just pushed out. Why? Because people like me know how they feel as a recipient country. And also people like me know what the recipient countries feel. And then we know how difficult it is to put the traditional medicine onto a table of recipient countries. We have full of our heart. So you can be very approachable. I'm approachable personally, and I have my beard growing to appeal to the people in the Central Asian countries. So we have a lot to offer them. Second is the core second core vision is success stories, and this is really like a textbook. We have development that we have done so far. You just follow your track. That's true. We are here as an open book for them to copy me. The thing is that the president of one country can write to me, so the content of the letter says that they want to make a national hospital with the traditional medicine. The answer by me is that yes, I can do it. I can make a 5-year plan because Korean thing is the cheapest one among many other countries. And also, I believe that the indigenous system can be improved. Secondly, as for the healthcare, we can also make the improvement for them. And also, we can have the reduction of inequality. We have a lot of experiences having done that. The third one is that as a traditional medicine, if you really want to go for the ODA strategy making, I believe that the Korea is the most detailed country because China and India are making their own efforts, but they are not up to our level. So maybe I am over flattering myself, but maybe Korea is the only country to do that. The China was also not up to our level. India was also hasn't done that. So the core values, as I think, are the ownership, alignment and participation, effectiveness, and performance-based management, SDGs, aid harmonization, partnership, and sustainable networks. Out of things that we have heard from other speakers, I have some areas that I want to disagree respectfully is that I want to put Korean medicine should be also inside the Korean category. So I believe that there should not be something only for the sake of Korean medicine only. We can just take whatever it is available for us. We didn't know what we had as our weapons. I think that's the biggest issue for us because we had something, but we didn't know that. So, as a science guy, I have to emphasize the importance of efficacy. So we don't have to change a lot. No, we only already had a lot, and we can just change the name a little bit. Having said that, if I give you a joke, please give me 1 billion won, and I'll be there for you to change any country. And also, we have had other standards coming from other countries like the US. I can make the international standard for you. So the reason I'm saying these kinds of jokes is because I have a lot more other colleagues with me. As I said, and I have professors who are working on the herbal medicines and the acupuncture. So we are a team. So I have a team of all these experts. That's why I can proudly say that I can do that. This is for your reference. We have the DOI 10.13048 slash JKM dot 24019. In this process of doing the research, I had separate plans for the research, but I will believe that it will be more beneficial for you to read the paper itself. So ChatGPT might help you to understand better by giving you some kind of detailed explanation or summary. So this is your reference. So if you have any questions, I'll be around. So please grab me and ask me questions. And also, if I may give you the update of the project. In my opinion, I don't know what Turkmenia thinks, but in my opinion, the Korean Medicine Center can be established and we can provide a master plan for the journey of Korean medicine development. I'm saying this because the countries that are developing and asking for help for us do not know what they really want. We know them because we have done that, but the starting countries will not know what's coming to them later. Therefore, from that perspective, master plans can be done by us for them. Therefore, I believe my experiences overseas have been very useful. I've been in the US for 6 years, starting at the Harvard Medical School, and I was a researcher, and I was also working in the other countries. I was in the military as a doctor, I was in the private industry. I am an academician at a university now. So all these people must be in the audience now. So I really hope that the ODA can be further understood by you, and also the national policy can be provided. If I can be a role model, if I may, I believe that the development will be coming to us. Thank you very much. Thank you so much.
효과적인 ODA는 무엇인지 다시 한번 생각해 보게끔 하는 시간을 가질 수 있었던 것 같습니다. 네, 공여국 중심이 아닌 수혜국 중심의 ODA, 지속 가능한 ODA를 위해 또 어떤 모델을 만들면 좋을지 설명해 주신 최한 교수님의 유익한 강의 감사드립니다. 네, 그럼 오늘 세션
So thank you very much. Now we will move on to the next presentation.
our last speaker of the session, folk media in the 죄송합니다. folk medicine in the Republic of Uzbekistan and Korean cooperation 이라는 제목으로 우즈베키스탄 전통의학 과학 임상센터의
So we'd like to invite the Jamshid Mirakhimov from Uzbekistan.
next speaker, Dr. Jashid Murakhomov, director of the Republican Scientific Practical Center of Folk Medicine in Uzbekistan. 여러분 큰 박수 부탁드립니다.
Hello everyone. Before the beginning of my speech, I want to thank all the organization for the invitation. I hope that this will be a good chance to develop our partnership between the two countries. Everyone knows that one of the areas necessary for human life is the improvement of healthcare system. In our country, in order to create high quality medical care for the prevention, diagnosis and treatment of disease, conducting scientific research and laboratory studies, the development of the direction of the folk of or traditional system of medicine has become relevant. As a result, in order to improve the efficiency, quality and convenience of medical services to the population in the country, several regulatory documents in this area were adopted. One of these documents is the decree of President of Uzbekistan dated October 12, 2018, number 9068 on measures to regulate the sphere of traditional medicine in the Republic of Uzbekistan. I will introduce more about this decree. This first, traditional medicine has been recognized as an additional way of providing medical care to the population. Second, licensing of traditional medicine services is carried out in the all the established for licensing of medical activities, expert for the requirement of medical education information. Third, according to the results of their activities, persons providing healthcare services are responsible for the medical personnel in the amount provided by the legislation. Next, requirements to medical care also apply to persons in agency in ethnosis. And at the last, the Ministry of Health is the authorized body that determines the requirements for traditional medicine as well as scope and procedure for providing services. In accordance with Ordinance number 3968, October 12, 2018, a special commissions was set up and under the ministry to license the medical activities of those who use folk medicine methods. The declaration of traditional medicine was included in the nomenclature of types of medical specialization in which medical activity is carried out. Using the methods of traditional medicine, a regulation on the procedure and scopes of medical activities was developed. Number 3T111, December 29, 2018. Minimum requirements for equipment and technical means used in the framework of medical activities with the help of traditional medicine methods were developed. Using the methods of traditional medicine, sanitary rules, norms and hygienic standards for buildings intended for medical activities were developed. Additions have been made to the sampling regarding sanitary rules, norms, and hygienic standards for premises intended for medical activities using traditional medicine methods. Amendments have been made to the regulation on licensing of medical activities approved by the resolution of the Cabinet of Ministers of the Republic of Uzbekistan, number 405, dated 21 June 2017, providing for the licensing activities for the provision of services using traditional medicine methods. The next documents is the President Decision number 4068 of April 10, 2020 on additional measures for the development of traditional medicine in the Republic of Uzbekistan. Proposals of the Ministry of Health, Ministry of Higher and Secondary Specialized Education of the Republic of Uzbekistan. The Republican Scientific and Practical Center of the Traditional Medicine. Referring to as the Republican Center with the status of a legal entity in the form of the state institution. Regional folk medicine centers in higher medical educational institutions and technical schools of public health. These pictures are showing our partnership and cooperation of Uzbekistan with Korea, especially Republican Scientific and Practical Center of Traditional Medicine. Specialists from NICOM came to our center a few times, and we discussed about developing traditional medicine not only in Uzbekistan but in Central Asia. Our Republican Center and National Institute NICOM signed memorandum of understanding, and then we visited office, factory and laboratories of NICOM, where they produced and do the laboratory research about herbal medicine. Specialists from the Ministry of Health of Korea have visited in Uzbekistan and learned more about the situation activated and all the work that are being done in Uzbekistan. They also visited our center. Professors and specialists from Daeguhan University came to our Republican Scientific and Practical Center of Traditional Medicine, where they got acquainted with our work and learned about what activities we are doing. We are participating in Daeguhan University academic industry and the showcase and discuss it about a lot of things that we can do to the world field. We went to Korea and participate in global healthcare and medical tourism conferences. We also attended in the training for the Central Asia industrialization of traditional medicine herbs in 2023. July of 2023, we visited Korea Institute of Oriental Medicine and attended Central Asia Delegation Corporation meeting. In summer of 2024, specialists from NICOM came and had a meeting about GMP product. I want to express my special grateful to Koika specialist Professor Song. Thanks to him, we are education and teaching doctors and students about traditional medicine, especially acupuncture. Korean Oriental Medical Service team about Comstar contacted medical volunteers work in the Tashkent in our center. They provided free medical services to people, and our students learned a lot of things from them. This is my like picture. And the next document is resolution of the President of the Republic of Uzbekistan dated May 2020 to number RP 250 on measures for the registration organization of culture cultivation processing in widespread use of medicinal plants in treatment. This is step by step. This is our working. Next. In this slide, can see the special summer camp training students that study traditional medicine in our center. We took them to the mountains, nature, to learn more about the medicinal herbs. We also have a planned project with NICOM for agreement of traditional medicine industry and educational research capacity building in Uzbekistan. It is planned for 5 years from 2026 to 23. Total budget of this project is $5 million. Goal of the project is aimed at strengthening the advanced technological capabilities, educational level, and qualification of traditional medical personnel of the 10 medical schools in Uzbekistan on behalf of the government of Uzbekistan. This slide, this is the PCP plan, PCP 2025, Minister of Health, Country Republic of Uzbekistan, Summer of Recourse Training course for health professional education specialists for health policy administrations for clinical experts, biomedical engineering, and other medical specialists. It's the end of my presentation. Thank you for attention.
네, 감사합니다. Thank you very much. Thank you very much for your informative presentation. Thank you. 네, 이렇게 네 분의 연설로부터 발표를 모두
Now that we have listened to all four speakers, we will now have a Q&A session that we actually provided to you before. So anyone who has a question to all these speakers in the session 2, please raise your hand. Yes, please. will deliver the microphone. Please stand up and identify yourself. Also, you may go on with your question. Thank you very much. I am Lee Hyo-eun. I am a junior in Gachon Medical School. I am very much impressed by all the speeches today. It is my first time to be exposed to the Korean traditional medicine today. I got more interested than ever before. After graduating from school, I wanted to become a clinician, but I heard today that the researches would be more important for the academicians. But as for me, I don't think I'm a research person, but I'm more inclined to the clinical trials, so and also clinical practices. So as for the clinical Korean medicine doctors, can we play any role in this ODA? And also, what kind of preparation should be made in order to become a clinician as a traditional medicine doctor? So, who would like to ask your question to? Professor Che or Mr. Kim Jae-gyun from ADB? Yes, either one can answer the question. Thank you very much for your question. As for me, I'm a veterinary medicine doctor, but I'm not a clinician. I'm working in the international organization. But if you want to be an ODA expert, you have to go to the graduate school for the healthcare studies. There can be many ways for you to develop your career after graduating from that graduate school. There can be many other schools, and there can be the organizations, consulting firms, and national institutions like KOICA. So you can go on with your career after graduating from those kinds of graduate schools. Thank you very much, and thank you for the question, and also thank you for the answer. Because of the time constraint, this has been the only one, but I would like to give the chance to Professor Chehan for answering that question. I'm sorry to interrupt. I'm not an expert in the healthcare industry, so you shouldn't do the healthcare industry. I'm very sorry to say that it's not the career that you have to go for. You should go to international organizations, not the healthcare science. So I'm very shortcut in my remark to you. Thank you very much. That was really shortcut answer. So it has been a great opportunity for us to get together to discuss these important issues. This has been the end of the day one of 2024 International Symposium on Traditional Medicine. We'd like to see you again tomorrow morning. So please be back and I'll see you then. Thank you. Also, we also have a surveys that we distributed to you for our programs. So you can either scan mobile QR code to check into the page of the surveys. 150 people who have completed the surveys will be provided with our gifts. So I hope we can have the great participation. And also announcement for the bus. The bus will start from Shinhwa World to go to the Jeju International Airport starting from 5 p.m. at landing building of Shinhwa World. It's only 2 minutes away. Sorry about that. Tomorrow we will have another shuttle services, and please check your bus routes at the webpage. We'll have the welcoming party tonight. For those of you who have been invited to them, please be guided by our staff members immediately after this event to go to the entrance of the landing building. You will take the bus to the venue of the dinner.
Dinner banquet tonight, please follow our staff members to the landing result entrance on the first floor and take a shuttle bus heading to the dinner banquet venue. 네, 그럼 여러분 오늘 이렇게 세션 1, 2를 마무리하도록 하겠습니다. 내일 뵙겠습니다. 감사합니다.